Washington Journal continues.
Republican Congressman Tim Murphy is back at our desk. Advocate for reform in mental health treatment joins us now for the first time since his Helping Families in Mental Health Crisis Act was signed into law at the end of last year. So, Congressman, let's talk about the implementation of that law. You've called the mental health system in the U.S. broken. Is it starting to be fixed?
Not yet, but we have an opportunity here. Our bill was signed into law by President Obama last December. We still have to put some funding in place, and regulations need to be written by Dr. Price at HHS, a number of critically important changes in how we handle family involvement in cases, how we restructure substance abuse and mental health service administration, how grants are given out, coordination of agencies. The foundation has been set, the mission has been put out there, but now it's a matter of putting leadership in charge who are going to put these things into place.
To remind our viewers, you have come on to talk about that bill before, but the Helping Families in Mental Health Crisis Act, some of the things it does: expands Medicaid patients' access to inpatient psychiatric care, ties program grants to measurable outcomes, makes it easier for caregivers to access treatment plans of patients with severe mental illness that impair their ability to make decisions about their own care, and it creates the position of Assistant Secretary for Mental Health and Substance Abuse. That's just some of the things this bill does, but that last piece, the leadership component, the new Assistant Secretary for Mental Health and Substance Abuse, what is that job supposed to do?
Well, given that throughout our hearings we were alerted time and time again by families around the country and by professionals, psychiatrists, psychologists, etc., is that agency was a sham. And I don't use that word lightly. That the kind of things that they were funding over the years was feel-good and actually anti-science, anti-psychiatric approaches. It was workshops on how to get off your medication, on interpretive dancing, on making masks to understand your personality, making collages, websites of sing-along songs for children that cost hundreds of thousands of dollars, websites and crisis lines you could call if you're upset about snow. I'm not making this stuff up. It was so directed in the area of happiness, and yet was also very much in denial that schizophrenia even existed.
This is the agency known as SAMHSA, the Substance Abuse and Mental Health Services Administration.
It was even along the lines where they said that schizophrenia and hallucinations were just a non-consensus reality, or it was simply a matter that just a different way of thinking of experience. It set the field back so far, I believe it actually caused damage, and I believe it maintained the stigma that's saying we just had to consider this wellness or difference of perceptions. And my question is, how many people that it actually encouraged don't seek treatment, don't get help? And during this time, period of years, suicide rates continue to climb upward dramatically. Substance abuse rates, death rates continue to climb dramatically. Mentally ill still put in prison, etc. And this agency was more focused on the rights of people to be sick than their rights to be well. It actively fought against the passage of this legislation. When I sat with Pamela Hyde, who at that time was the administrator, and I said, would you change anything after hearing all this testimony about all your problems and all the misspent tens of millions, hundreds of millions of money over the years? She said, no, I wouldn't change a thing. It concerned me greatly. And so that's why Congress, in a vote of 422-2, said, let's put someone in charge here who's going to restructure this. Let's advance the title to Assistant Secretary of Mental Health. They'll be the wing person to Secretary of HHS, say, let's revise this. Let's make modifications to Medicaid. Let's make sure families can get involved. Let's change these laws and regulations. It is absolutely critical that anything we do, the person in charge of that Assistant Secretary has to be the right person ready for bold leadership.
And the Trump administration has selected somebody to lead that organization, to fill that job that you helped create. And you have some concerns with that person.
I have grave concerns.
Who is it?
I am actually flabbergasted. So it's a Dr. Eleanor McCants. Now, by title, it sounds good, a psychiatrist, MD, PhD, but it is someone who was actually the chief medical director of that agency at the very time it had its biggest problems.
In SAMHSA.
In SAMHSA. Now, after she left the agency, she published an article in the Psychiatric Times that said a number of things here, that SAMHSA does not address the treatment needs of most vulnerable. It focuses on its own definition of recovery and focuses on development of a peer workforce, not psychiatrists, psychologists. She questions SAMHSA's function, that when the SAMHSA questioned whether mental disorders even existed. She said that significant dollars are spent on hotlines for callers who may be experiencing suicide, but rates were getting worse. She said the programs undertake a, quote, re-education, unquote, of mental health practitioners who assume to be abusers of consumer rights rather than work on treatment. She said they focus more on peer support than other things. She said there's real and pressing needs that are not being addressed. Now, here's my problem. She was in charge. She was the chief medical officer at the time that this abuse was taking place. And while she was there, she didn't speak up. Now, let me explain why this is important. I'm a psychologist. She's a psychiatrist. People in the healthcare field have ethical standards they have to adhere to. And part of that standard is you make sure you're not doing wrong. But if you know one of your peers in the field is mistreating a patient, not following up with the right treatment, we have an ethical obligation to speak up as well. And I asked her about this. In my office, I said, were you aware that the things that Pamela Hyde, then administrator, was saying in front of our committee was wrong? And she said, yes, she felt embarrassed for her. I said, all these things, the SAMHSA was fighting our bill even passing, fighting the creation of the assistant secretary position, fighting the kind of accountability we wanted to have, working against our legislation. She was the chief medical officer. And I said, why didn't you speak up? And her response was, I wanted to finish the 2 years of my contract. That, to me, is a serious concern.
We're talking with Congressman Tim Murphy about this issue of mental health substance abuse policy in the United States. Want to note a special line we have in this segment for those who have experience in the mental health system. It's 202-748-8003. Really do want to hear your stories, so you can start dialing in on that line. Otherwise, lines as usual, Republicans 202-748-8001, Democrats 202-748-8000, Independents 202-748-8002. Before we leave this topic of the nominee for that new position of Assistant Secretary for Mental Health and Substance Abuse, does she have support within Congress? Do you think that that nomination will be confirmed?
I think she has support among people who have no idea what they're talking about. And I don't use that lightly. Because if someone notes that if this person was in charge and then says, I'm not taking responsibility for what I did, that person shouldn't be there. Would we tolerate someone being an assistant secretary in the Department of Defense who was in charge at a time when problems and scandals occurred within one of the branches of the military? No. Would we tolerate this anywhere else? Now, sometimes, sadly, the standard for confirming someone is they don't have any terrible scandals in their background. The issue is we need someone with bold leadership, not someone who is self-admitting that she didn't have the courage to speak up. Now, this is very important, too, because part of the problem we battle is stigma. And when it comes to mental health, there's millions of families out there who know that they're blocked from sharing in helping with their own son or daughter or father, mother, brother, and sister because the HIPAA laws say their rights to be sick outweighs your right to help them, even though we know when family members can help. Dr. Katz was part of that regime, and she failed to speak up. We know that there's problems also with getting information from people with substance abuse. She was part of that regime and she failed to speak up. I consider that to be an incredibly serious problem. And I hope the president withdraws this nomination. I hope if she advances forward, the Senate doesn't confirm that, because this is so important that she was there at the time, that she created and helped maintain these, even by her absence of speaking up. And in this field, one of the things we refer to as someone who has a mental health disorder is codependency or a concurrence in this by silence. She was part of that, and she doesn't deserve to be assistant secretary.
Let's get you some calls on that line for those with experience in the mental health system. Darlene's up first in Clark County, Nevada. Independent. Darlene, good morning.
Good morning, sir. Thank you for your time as well as your lovely comments. I currently work as a power of attorney for someone who's paranoid schizophrenic, and the system is just amazing. I came in knowing more than the psychiatrist and the psychologist he was supposed to be dealing with. They didn't even have so much as PDRs in their office and wanted to give out contraindicating drugs.
What's a PDR?
I've watched my...
Physician desk reference, a reference in terms of what psychiatric medications are about.
Thank you. Darlene, go ahead.
And I've watched my poor brother, who is now 50 years old, and back in the day, they didn't have names for mental illness. So unfortunately, he did turn to substance abuse because methamphetamines, before we started handing out Adderall like candy, methamphetamines were the only thing that made him feel normal. And being of age, we couldn't get him into mental health programs. He's now on his third strike and residing in prison.
So with regard to the... I'm sorry, go ahead and answer your question.
What is it that you could possibly do to help make mental health services more accessible to people who are in prison so that they can come out better human beings and in actual control of their mental illness?
Well, sadly, the majority of people in state and county prisons have mental illness, federal penitentiaries as well. about 80% of them receive no treatment at all. Many of them get medication, but it's not really closely monitored. Listen, my state of Pennsylvania is just as much a culprit of that. For example, people who commit a crime and are waiting to have a review of their competency may sit in a jail cell for 100 days, 300 days, waiting for an evaluation that was supposed to take place in the first 7 days. It is a crime upon those with mental illness. And I bring it back to this agency. This agency did nothing. And this woman, Eleanor Katz, never spoke up, and never stood up to the people within her agency. She should have said, look, you either change your policies or I'm out of here. There have been other psychiatrists who were in that agency that said, I'm not going along with this anymore. She didn't. She didn't, and that's more reason why the Senate should say we're not confirming her, and the president should withdraw this nomination.
Do you have somebody in mind who should have been chosen for this post?
There was other ones that they considered, and I'm happy Dr. Price did consider some of those, but not her. There's tens of thousands of psychiatrists, psychologists in America.
It had to be somebody from outside that agency.
I would think that helps, but not someone who was a key player within that. Now, one of the things I also want to point out that Dr. Katz told me was that I said, why does this agency have so many problems with the grants? The General Accounting Office said only 20% of them have any accountability.
And she told you this in a congressional hearing?
She told us in my office, told me this in my office with my staff present, so the witnesses to this. And she says, well, there's not a lot of people within SAMHSA who have subject matter expertise. And I said, well, then what do you do? She says, well, we contract with outside agencies at the cost of millions of dollars to hire them. I said, where do they get the expertise? She said, well, it's former SAMHSA employees who may go work with them. And I said, would you continue that practice of hiring former employees who come back at a higher rate of payment? She said, oh, yeah. I said, well, this is what the president talked about, draining the swamp. You can't be doing that so people can jump one job, come back paying more for this, and still maintain that level of incompetency.
Let's go to Lisa, Shreveport, Louisiana, Republican. Lisa, good morning.
Good morning. How are you doing today? Thank you very much. My son is 28 years old. He graduated from the University of New Orleans, and he got addicted to Adderall going through grad school. He is now on meth. He is completely paranoid. He was graduated in chemistry and was going to get his PhD, and we put him in the University Health in Shreveport, Louisiana. They kept him for 12 hours only and let him out. And now he has beat me up. He has beat up his brother. He is living with his father, and we do not know what to do.
Lisa, let me ask you this question. While all this was going on, how do you react if you hear that the key federal agency that's tasked with fixing this was sending out messages that people should get off their medication, or that schizophrenia doesn't really exist, or you can fix it with fish oil, or you can with interpretive dancing? How do you feel about a federal agency and your taxpayer dollars going to an agency that says things like that?
I think it's ridiculous.
And I hope you and every other American listening to this writes a letter to their senator and writes a letter to the President of the United States that says, withdraw Eleanor Katz as the nominee to assist the Secretary of Mental Health. It is wrong for America, and this is setting us back in the field by decades.
We lost Lisa. Brian is on that line for those with experience in the mental health system in North Judson, Indiana. Brian, good morning.
Good morning, and thank you for taking my call.
Sure,
I'm an avid C-SPAN watcher, and this is a subject that touches my heart deeply. I have a brother who's 42, or for 42 years has been a thorn in my side from the time he was 19 years old till he's now 56, and he's been put on my plate because I've been the only one that's been able to deal with him, and I've had to have him committed over 100 times. He's been in every facility in Indiana and in Illinois, and it's a revolving door.
It's terrible.
My brother's last episode, he went in because he thought he didn't feel right. They released him. He drove 100 miles to where he used to live, ended up getting arrested, and no one's telling me anything in Stark County, Indiana, but he ends up losing his eye.
Wow. Brian, what do you want done in this situation? What could help you?
Well, group homes, there's no facilities in Indiana whatsoever.
Well, think of this too, Brian, that this is part of what SAMHSA, the agency, was fighting, was even your ability to know. HIPAA laws, I believe, need to change. In this bill, we call for HHS to review and revise these regulations so that doctors may, under some very special, limited circumstances, would be able to have a compassionate communication with you and at least let you know what kind of medication was he on, when is his next appointment, not maintain other areas of confidentiality and privacy. SAMHSA fought us on this. They blocked us on this. They spoke out against this. And again, Dr. Katz was silent on this. Let me say something that's I have to restate. In this field, we as doctors, if we see something wrong, we are obligated to speak up. That is in our code of ethics. Her silence was damning. And in this case, when you and the previous callers have described the anguish and pain you felt, again, write your senators and say, do not vote for her, and write the president and say, get her name off this list. Get someone else in here, not someone else who's part of the problem.
You've expressed a lot of concern with this choice. Does this choice make you rethink the Trump administration's commitment to mental health and substance abuse?
I don't know. I know. Listen, the president is absolutely committed to this. He is passionate about this. I was sat yesterday with Governor Christie and among his commission to talk about this, members of Congress.
The commission he's leading
yes.
to combat substance abuse.
The president has this in his heart. I know when he told me about his own brother dying of alcohol abuse. The president absolutely knows. He is absolutely committed to this. I share his passion on this. But I don't know where he got the information on this nominee. It certainly wasn't talking to me, and it certainly wasn't doing any research. 4 years of congressional investigation said this agency is a sham and needs to be fixed. And someone advanced a name here without really looking at the problem in charge. This is wrong for America. This is a slap in the face to people with mental illness across this country.
Pastor has experience in the mental health system. Ithaca, New York, independent. Good morning.
Good morning, John. I don't know your last name. Thank you for hosting. Thank you, Congressman Murphy. I've seen you several times on the Washington Journal. This is Pastor Michael Vincent Crea. You can find me on Facebook, Michael Vincent Crea. And today I actually had a post. The sheriff, David Clark of Milwaukee County, actually had an inmate with schizophrenia die after they denied him water for 7 days.
Wow.
Now, this is just reprehensible. But I live with my own mental challenges. I'm not afraid to speak about it, but that's part of the problem. I had graduated from Cornell University. I was raped in the New York Seminary. I have my Master's of Divinity just miles from where you sit at Catholic University. And I was a case manager for the mentally challenged individuals at Wall Street's Trinity Church's drop-in center. What we don't have is enough staff to listen. Yeah. We don't have enough staff to work with individuals. We are overburdened and understaffed and under-resourced.
It's incredible.
I myself here, with my own service dog, find constant discrimination. Living with post-traumatic stress, one need not resort to violence. One ends up isolating, and that's not good.
Yes, it's not good. You're bringing up a great point. My heart goes out to you, and God bless you for advancing and showing that people with mental illness can lead productive lives. But again, I go back to the point when you use the word stigma, that this agency of SAMHSA, which Dr. Katz was the chief medical officer in charge there, during that time, they actually talked against stigma but maintained it. More people ended up in prison. More people ended up without treatment in prison. More people ended up dying of suicide and substance abuse under her watch. And she writes an article a year later criticizing them, which to me I think is one of the most damning things of all. It's her admission that she knew there were problems and she did not speak up while she was there. This is the kind of thing where if a person had some courage and spine, they'd say, you know what, either you change your policy there or I'm out of there. And there have been other staff at SAMHSA who did have the noble choice of resigning in that, and she didn't. She said she just wanted to wait out her contract to keep getting her paychecks.
Pastor Michael talked about not enough funding for the program that he was working in. I know at the end of the American Health Care Act debate, right before it was pulled from the floor, there was an effort to get more funding for mental health treatment, something you worked on. So explain that, and will that translate into whatever next legislation comes down?
It'll help a lot. The 21st Century Cures bill that was passed actually puts $500 million a year into states to help them with substance abuse. The amendment that will be considered for the Health Care Reform Act includes $15 billion to go to states over a period of about 6 years, of that to be used for inpatient and outpatient care for mental illness, and also identification treatment for adolescents and youth with severe mental illness.
So what happens to that now that that's been sidelined?
Well, that will still be an active amendment on the bill. But the issue is how we handle that. Part of the problem he's describing, half the counties in America don't have psychiatrists, psychologists, clinical social workers. I think the shortage is even worse for people who are trained and licensed substance abuse therapists. What is a no comfort to him, and what a pastor, I know you probably follow the Lord's work and says don't be angry, but how could we not be angry when we realize this agency was wasting money, wasting taxpayers' money on programs that actually set the field back by telling people that schizophrenia isn't real, by having them make collages, by spending $400,000 on a children's sing-along website. And when we questioned the director of that agency about that, she said, it was just there for prevention. It was colossal waste, and they wouldn't acknowledge that they were really committing a professional malpractice in this.
What's happened to SAMHSA's budget in the president's budget proposal?
The budget will be there, and there's more funding that can go in there, but without accountability, this is useless. The reason we created that position was add accountability there. The first person there should be a person who's bold and courageous, not someone who, by own self-admission, says, I'd rather have a paycheck than ethics in this situation, and speak up on behalf of Americans. And again, I call upon people, write your senator, write the president, say, withdraw this person's name. She is the wrong person for this position.
A few minutes left with Congressman Tim Murphy, Republican of Pennsylvania, serves on the Congressional Mental Health Caucus, the co-chair there, and on the Energy and Commerce Subcommittee on Oversight and Investigations, the chairman there. Valdez is in Mapleton, Illinois, and independent, also with experience in the mental health system. Good morning.
Yeah, good morning. Dr. Murphy, you picked kind of a bad time to address this issue. I started in police work in 1981 in California. I retired after 23 years. And that started that slide of mental health facilities that has continued to today, through today. And I don't think there is a good answer. The work is extremely difficult, meaning the mental health field. The pay is very poor. And what we called 5150s, when we'd get the dispatch call, we'd run as far away as we could from those folks. Unfortunately, their hygiene was horrible. We didn't know what to do with them. And all I could tell you is that it's gotten much worse now, and now we don't have the money to address that problem. And we have these unfortunate people wandering the streets, and we have no place to put them. So I don't know what you intend to do.
Keep in mind here that also part of this, I think it was in 2015, a Washington Post report about 250 people with mental illness were killed in the encounter, and how many police officers were killed also when they approached someone with mental illness. Now, most people with mental illness are not violent, but people with severe mental illness who are not in treatment are 16 times more likely to be violent than someone who is in treatment. These are dangers important, and these are dangers that SAMHSA agency did not address while Dr. Katz was there. Instead, she chose to be silent on these issues. She specifically told me she decided not to speak up. We do not need, and it is harmful to have someone in charge who, by their own admission, is saying, I was silent at the time. I want bold leadership there. For all these families who called in today with incredible pain, and the thousands of others I've heard, it should outrage us to say that this time when this president who wants to put leadership into this thing, who wants to drain the swamp, you put an alligator in charge. This is not the thing to do.
What did Governor Chris Christie say to you? I assume you brought these concerns up to him.
He shares those concerns too. What Chris Christie is doing, Governor Christie is doing, is really pretty bold, inclusive, comprehensive, and very compassionate leadership in the substance abuse area. He recognizes several things. For example, federal laws that say you can't put information in the chart that someone has a substance abuse disorder, so doctors will make a mistake and prescribe an opioid for someone who actually it's a problem for. He recognizes also that we need to have more providers. We need to have more hospital beds for these folks. We simply don't have enough.
Does he agree that this nominee, though, is the wrong choice by the president?
I'll leave that conversation quiet at this point, but we'll just say that I think once people find out about her, they agree she should not be in there. And I hope to God, I pray that the Senate doesn't overlook this, because oftentimes they'll say, well, this person doesn't have any terrible scandals. If they're not involved with secret deals with Russia, we'll let them go through. But this is wrong.
Could you testify at her confirmation?
I would hope to, and I would tell the Senate, please don't do this. Look inside your conscience. Look inside the scandals within this agency, terrible things. And someone cannot use an excuse. I chose to say nothing at a time when people were dying and suffering. That is not an excuse in this field.
Tom's been waiting a while in Detroit, Michigan. Line for Democrats. Tom, good morning.
Good morning. John Dingell, the Republican, shut down all the mental facilities in Michigan. And you got people that are mentally ill being incarcerated with hardened criminals, and they have no place to go. And they walk in the streets saying, I work for food. Some of them are drug addicts, and some of them mentally ill. And if you watch TV, all those guys that go off and shoot and kill people and stuff, and the first thing we find out that they were mentally ill.
Many of them are. Some are not.
And so this country needs mentally ill facilities to take care of all of these people that have this mental problem. And nothing's being done about it. And I don't have no faith in the Republicans.
Well, sir, let me just say that the Democrat and Republican governors both work to close on those institutions. In Pennsylvania, our own governor is working to close down some more, too, and they refer to that as progress. It is not progress. We have to make sure that we have the facilities to treat people in need. We are short about 100,000 psychiatric hospital beds in America. What happens to those people who are in psychiatric crisis, they either languish in an emergency room, or they're back on the streets, sleeping on some bench, or they're in the county morgue. Or they're sent back to families and say, we're not going to tell you what's going on. And again, SAMHSA was part of that legacy of pushing for closing those people, those down, and not having treatment for people, and that is shameful.
Last call, Susan, Nyack, New York, Independent. Good morning. Susan, you with us?
I guess not.
Go ahead, Susan.
Go ahead.
Susan, you got to stick by. Go ahead, Susan. Last try.
Sure. Yes, I was wondering if you could tell us about Michael Wellner, because I had read wonderful things about him, and he seems to have the courage. He's a psychiatrist. He's a forensic psychiatrist.
Right. Michael Wellner was someone else they were considering for that position. I think would be fine for that position. And I recognize the president's got to review a number of things here. And look, the point is there's tens of thousands of psychiatrists, psychologists could be reviewed in America. But please, please tell the Senate and tell the president, do not let it be Eleanor Katz. She is the wrong person for this job. She was there at a time that had all these problems and failed to speak up, and that is just wrong.
Congressman Tim Murphy, Republican from Pennsylvania, co-chair of the Congressional Mental Health Caucus. Always appreciate your time.
Good to see you today.
Up next, as the debate over health care continues to be waged on Capitol Hill, Congressional Management Foundation President Brad Fitch will be here to discuss the health care options that are available specifically for members of Congress and their staffs. We'll be right back.